So, columns and questions today, as we went through it, were about action potentials. We looked into action potentials and neurophysiology a lot today, and action potentials was a big thing, and some people and a lot of us had some trouble with understanding action potentials. So, what I'm going to try to do is strip this down to bone basics, just try to give you a good overview so that you can compare it to a lot of things and try to make sense of it all. And I really hope it helps. So first, I want to say before we can start learning about action potentials, we got to look at graded potentials one more time. And I talk about graded potentials in my last video, so if you want to check that out, check that out. But basically, graded potentials have hyperpolarization or depolarization, and really that's all you need to know because I'm not going to go deep into graded potentials right now, but we did go over what was known as summation. And basically summation, think of the first part, sum, that's addition. So if there's two things hyperpolarizing, you get double the stimulus. If there's two things depolarizing, you get double the depolarizing stimulus. If they are one is hyperpolarizing, one is depolarizing, they cancel each other out. That's pretty much all summation really means. Now, of course, there's a lot of more detailed neurophysiology that goes into it, but that's pretty much the bone basic of what summation is for graded potential. Now let's go to what this says. Neuroaction potentials, what is going on? Action potentials always run down an axon, and they're also known as an impulse. So an axon is, if you look at the diagram in your textbook of a neuron, it's the long tail piece. Just strip it down so that you can picture it in your head without looking at a diagram. It's a long tail piece that if it's covered with myelin sheets, it's kind of like a row of sausages. That's the axon. So just if you can picture that in your head right now, there look like tree branches coming out from one side, a cell in the middle, and then a long tail of sausages coming out the other side. And that is the sausage end is the axon, and that's where all the action potential stuff happens. So that's where you want to focus right now, that axon. So it's again called an impulse, and it runs in a series of phases. You got the depolarizing phase, the repolarizing phase, and then possibly after hyperpolarizing phase. And now remember, we are talking about inside this membrane right now. All of this we're talking about inside the membrane of the axon. That's where all the action potential theory happens, physiology happens. So, and that's what I'm going to try to explain, strip down to the bone basics here. So let's talk about some numbers for a minute. Stimulus and thresholds. So what do I mean? So I'm going to make an analogy in a little bit, but let's go and look at what a threshold is first. So our resting membrane potential is negative 70 millivolts. That's the number you got to remember. On the inside of the membrane and the outside in the extracellular fluid, when our whole cell is at rest and there's no action potential, it's negative 70 millivolts. A threshold is when there's enough stimulus to reach negative 55 millivolts, and that's when an action potential has enough charge to actually start. So what does that mean? Inside the cell, it gained less of a negative charge to negative 55 millivolts, and that's when, of course, an action potential will start, and the whole cycle will start normal. It's normal cycle. Nothing else happens then. So what does subthreshold mean in this list? It doesn't reach up to negative 55 millivolts, so it can't start an action potential. So below. A threshold stimulus, just enough stimulus to start an action potential. So just hitting that negative 55. everything's in millivolts here. We're talking really tiny. So just enough to hit that magic number of negative 55 millivolts. And a super threshold is enough where it overshot the negative 55 to where it's like negative 35 millivolts. And so that immediately starts an action potential, and a very big one, to where it can cycle to 2, 3, 4, 5, 6 action potentials. And then once an action potential starts, we are hitting the all or none principle. And you probably remember that from your musculoskeletal system. So the analogy I was going to make is, if you've ever gone to the doctor and they do that thing with the reflex hammer to test your reflexes, they tap your knee with a little hammer. So if they hit your knee with a toothpick, they aren't creating much of a stimulus for your knee to kick forward and extend, do they? If they hit it with a toothpick. So that would be a subthreshold stimulus. It didn't stimulate the nerves enough to cause it to send an electrical signal up the axon saying, we want the knee to extend. It's up to your brain and then back down and then extend. Now when they hit it with the reflex hammer, usually they're hitting your threshold stimulus, saying just enough for the reflex so that your knee will sort of extend without you thinking about it. Now if they took a baseball bat and just swung and whacked your knee as hard as they can, they overshot negative 55 millivolts, and you're going to grasp your knee in pain, extend it, flex it, move it all around, saying, oh damn, why the hell did they do that? So no doctor's going to hit you with a baseball bat, but that's exactly, if you get the analogy, that's my point. Toothpick, reflex hammer, baseball bat. It all attracts to the all or none principle, though. So if you get that, then you've probably understood the numbers, but you've got to memorize the numbers, and there are more numbers coming this way, so don't think you're out of the woods yet. So what's the depolarizing phase? Well, voltage-gated sodium ion channels open, and I talked about ion channels in my last video too, and in a depolarizing phase, the sodium channels open. Only the sodium channels open first in the depolarizing phase. And it causes a high inflow of sodium. And then the threshold number of negative 55 millivolts, which started the action potential, jumps to a positive 30 millivolts inside the membrane. And if you look at a diagram on page 425 of your textbook, there are two gates on a voltage ion channel for sodium, and called the activation and inactivation gates. And the inactivation gate is open when not in use, and the activation gate is shut. And when depolarizing, the activation gate opens for influx of sodium. That's all it is. And then when in the next phases, such as repolarizing, the activation gates, the inactivation gate shuts, and then soon the activation gate will shut, and so on and so forth. But you've always heard of the sodium-potassium pump. So remember, inflow of sodium in the depolarizing phase, that's what shoots the negative 55 millivolts up to 30 millivolts, positive 30 millivolts inside the membrane. And that's the depolarization that really kicks off the action potential to keep moving up the axon. But you've heard, again, like I said, the sodium-potassium pump. So what about the potassium? Does it have anything to do in the depolarizing phase? And the thing is, no, because it's still depolarizing to become positive inside the membrane and negative outside. Potassium happens in the next phase, which is repolarizing. So it basically does the opposite. Potassium voltage ion channels are a lot slower to open, and they do not have two gates on them. They are a lot slower to open. So the inactivation gates are shutting already on the sodium channels to stop inflow of sodium when the potassium gate opens, allowing potassium to exit. This would do, if you guessed it already, this would reduce the positive charge inside the membrane. So repolarization from that positive 30 millivolts we have here, it's dropping it back down to negative 70. So it's got to drop negative, it's got to subtract 100 millivolts back to its resting here, negative 70 millivolts. So that's where it started at actually. So when I say here the 3:2 ratio, for every 3 ions of sodium that influx into the membrane, so inside the cell of the axon, during repolarization, 2 ions of potassium will leave because, like I said, potassium voltage ion channels are a lot slower than sodium ion channels. Those are very fast. And this is a lot more of a biochemistry topic, but it's something to keep in mind, the 3:2 ratio of the sodium potassium pump, because that's what really moves the action potential along the entire axon, even if it's from your foot to your head. So what do we have down here? The after hyperpolarizing phase. Well, since potassium voltage ion channels are slow and only have one gate or door or whatever you want to call it, so it takes a while to move from activated to resting or resting to activated. So sometimes they may release so much potassium as they're trying to shut that the inside of the cell of the axon might become lower than negative 70 millivolts and drop as low as negative 90 millivolts. But then it will finally settle back to negative 70 millivolts again when the potassium gates close, as sort of every chemical sort of moves around, finds its place, and all the gates shut and it's back to resting phase. And this is going on in like milliseconds to keep the action potential moving. Just to move this cursor around, the action potential is allowing my fingers to do that. So that's all the after hyperpolarizing phase is. It's just an extra burst of potassium is launched out of the cell that wasn't expected to, but it again goes back up to negative 70 millivolts, which was the resting phase, the starting number that I emphasized. So that's all these two phases are. This is where the potassium fits in. So our refractory period. Now this was something that people, I think, also got confused on. So absolute refractory period. This is when a second action potential cannot be initiated till the entire series of phases. So this whole cycle that I've just talked about, and the sodium channels have returned to resting state. So that magic number, that resting number of negative 70 millivolts, until the sodium channels and the inside and the outside have returned to that negative 70 millivolts, a second action potential cannot be initiated. And I've just included here an extra note that graded potentials, they don't have one, which is why they can only do a short communication lengths. And axons can communicate great lengths through your body. So what's the relative refractory period then? From the time that inactivated sodium voltage channels have returned to resting state. So sodium channels return to that negative 70 millivolts. But the potassium channels are slow to open and close, like I said in the last slide. So they are still open, still leaking potassium. So a second action potential already has the chance to start and might actually almost be starting while this is still leaking potassium. And then an action potential can be started by, it has to be started by the larger than normal stimulus during this relative refractory period. And then when it's started by a larger than normal stimulus, it takes a minute, well, milliseconds for that action potential to start and that sodium to start to flowing in again, and by that time the potassium gates have shut, and the whole cycle starts over again, starting with depolarization. So that's how the whole cycle works. So now this term in bold here, propagation. Now what does that mean? The action potential doesn't die after it's gone down one axon from one cell body. So the dendrites thing in your fingers, you pick something up, you feel it, you sense it, it goes down cell body, down that axon runs out. That action potential just doesn't die. It doesn't go away. It just spreads along the membrane. It keeps that action potential strength, and it keeps passing the baton, basically, down more and more axons till it reaches the control center and then back. By now you should know, by positive and negative feedback loops, this is exactly what those loops are. So, and people who know what the myelin sheaths are, basically action potentials can pass down the axon faster when it's myelinated. The bigger the axon, such as in your sciatic nerve, you have huge axons. And the bigger the axon, the faster the action potential goes. The warmer it is, the faster the action potential goes down the axon. The more myelin, the faster the action potential goes. And saltatory conduction is basically the action potential doing leapfrog over myelin sheets to the nodes of Ranvier, which we went over today in lecture. And basically, there's a few voltage channel ducts of the sodium and potassium that we just went over, and those are the ones that keep moving that action potential along an axon. And at these nodes of Ranvier, there's a whole cluster of them, huge cluster of them at each node, and that gives it a huge jump to jump it across the myelinated sheath. Of course, it has some help in the myelinated areas with a few ducts like that, but at each node there's a huge cluster of them that gives it a good push to make it, in layman's terms like that, of this sodium-potassium pump. And that's what keeps pushing this action potential along till it reaches its destination. And so that's why I say here, the action potential, AP stands for action potential. Action potential is faster with more voltage-gated channels, and I'm talking about the sodium-potassium gated sodium-potassium channels, because those are the ones, depolarization, repolarization, and then the hyperpolarization, refraction, and all of that. So that's what action potentials are. Propagation means basically passing the baton, and the baton is the action potential, and the axons are the people.